My name is Brandy Bradley, and I've been married for 24 years. We have 4 boys and a daughter that we lost to stillbirth. I've been a practicing physical therapist in an outpatient orthopedic clinic for over 20 years. As a healthcare worker who worked tirelessly through COVID, each day I take a personal oath to protect my patients, to do no harm, to research and provide the most up-to-date and effective treatment. Does everyone on this committee agree that we ran for office to protect the people in our community? Do we want to protect the children in our community? Don't you want to do anything and everything to protect your kids? This bill will protect kids. I know that the words COVID and vaccine have become very controversial under the Gold Dome, but that was not my intent of the bill. We as legislators vowed to hear each other out and have an open mind regardless of political affiliation, so you can imagine how troubling and concerning it is to hear this bill is headed to be killed before it was even introduced and before testimony was to be heard. That the people who showed up to testify in support of this bill aren't even given a fair chance to be heard, that your constituents aren't being represented. For the record, I am not an anti-vaxxer. Before COVID, my kids have been vaccinated for everything. Until this pandemic opened my eyes and I became aware that as a mom and a healthcare worker, I hadn't even been given informed consent before my children were given their vaccinations. I was told after my children received their shots to expect redness and or soreness at the injection site and perhaps a mild fever. I was never given the ingredients of the shot nor the litany of adverse reactions that could happen. A doctor might say, or a nurse, those risky side effects are very rare, and I will tell you, as a mom who only had a 1 in 10,000% chance of my baby dying in my belly, that doesn't mean anything to me. Informed consent is a principle in medical ethics and law and media studies that a patient must have sufficient information and understanding before making decisions about their medical care, with 4 components: decision making, documentation of consent, disclosure, and competency. The main purpose of informed consent is recognizing patients' rights, and the patient needs to know the risks and benefits of their options. Under Colorado state law, the age of competence for which someone is permitted to make decisions in regard to his or her own body is 18 years or older. Section 164.502 in Colorado Revised Statute states that a minor is someone who is 17 and younger, is generally considered not competent to make informed consent decisions, and as a result, the minor's parents provide informed consent for treatment. This should be an open and shut case and no bill required. So you may be wondering why I would even bring this bill forward. Because Senate Bill 21-016, Protecting Preventive Health Coverage, allows minors 12 and older to consent to obtain certain vaccines such as Hep A, Hep B, and HPV. Because states around this country are still attempting forced COVID vaccinations. With forced employee and employer mandates for the COVID vaccine, mandatory COVID vaccines to attend colleges and universities, parents are afraid that the COVID vaccine will eventually be mandated for school-age children. This bill takes a lot of fear out of that and allows parents to be engaged in their children's medical decisions. Colorado Department of Public Health and Environment's widely important goal is to make sure 41% of kids ages 5 to 11 are vaccinated from COVID by June 2023. Why? What is the driving force behind this goal for the percentage of the number of kids vaccinated? Who benefits from us hitting these goals? Because the research shows that this age group is not dying from COVID. But we do know, according to multiple studies, including a new one just released in New Zealand, that out of 4 million New Zealanders ages 5 and up, given 2 doses of Pfizer's COVID vaccine from February 2021 to February 2022, they found a 25.8% increased rate of myocarditis and pericarditis in those ages 5 to 19 within 21 days of the vaccine. The president's already announced the end of the national COVID emergency. So why are we spending money on mobile vaccine buses, media, and commercials when all this money could be spent on the youth mental health crisis? Because that is what is killing our kids in Colorado. When I contacted CDPHE to find out the cost of their wildly important goal, they didn't even have the budget yet. I want to remind everyone in this committee, the COVID vaccine is authorized to this day under emergency use authorization only. This means that the COVID vaccine has not been approved or licensed by the FDA, which is a distinct difference than all other childhood vaccines. An emergency use authorization requires fewer safety and efficacy data than full biologics license application. Approval, which may result in less trust in vaccines before administration, could be considered ongoing medical research. For comparison, the COVID-19 vaccine from Pfizer was under clinical development for 6 months before it submitted its EUA, and an EUA was granted in less than a month. The clinical development for most flu vaccines from phase 1 to approval is over 8 years. Again, the COVID vaccines are still under emergency use. A vaccine information statement, or a VIS, shows the benefits and or risks of every vaccine. There is no VIS for COVID-19 vaccines, but vaccine recipients are provided with certain vaccine-specific emergency use authorization info to help make an informed decision about the vaccine. Meaning there is no full disclosure regarding the COVID-19 vaccine. If adults aren't even given full disclosure and informed consent about this emergency use vaccine, how can we expect a 12-year-old to make that decision without parental consent? I know that this committee wants to protect kids. This bill meets that same goal. According to data from the Coronavirus Disease 2019 Associated Hospitalization Surveillance Network, hospitalization rates for 18 to 64-year-olds have increased 11% since the vaccine rollout, and kids under 18 have suffered a shocking 74% spike in hospitalizations. Countries from Denmark to Norway to Australia to the United Kingdom have suspended or even recommended against COVID shots for younger populations 50 and younger, due to considerable risks of adverse effects such as pulmonary embolism and myocarditis. A 12-year-old cannot understand the implications and risks of severe adverse events like myocarditis and pulmonary embolism. If we allow a minor to consent to this vaccine, knowing that adults aren't even given full disclosure about this vaccine, and if the parent is not aware of the medical choice of the minor, then who is liable when something goes wrong? One study of 8.9 million participants found a 9-fold increase in myocarditis among males 12 to 39 within 28 days of receiving the Moderna COVID-19 booster over those who stopped after 2 doses. Are you willing to make a health choice for a child, or should the parent be allowed to make that decision? This bill protects that child. Why hasn't CDPHE reported the vaccine failure rate, and why hasn't it been reported in years? In June 2021, the UK government's advisory body on vaccine, the Joint Committee Vaccinations and Immunization, declined to recommend COVID-19 vaccines for healthy children aged between 12 and 15, given the marginal benefits young teens would get from the vaccine and the lack of long-term data on the side effects, including myocarditis. In the Pfizer clinical trial, there were 0 cases of severe COVID-19 in children who did not receive the vaccine. In contrast, vaccinated children 5 to 11 years of age suffered severe systemic reactions within 7 days of the second dose at a range of 1 in 59 to 1 in 143. Why are we putting children through this if their risk from dying from COVID is 0.00001656% chance, according to data from the CDC, for 0 to 18-year-olds between January 2021 and January 2023. The frontal lobes in the brain are home to key components of the neural circuitry underlying executive functions, such as higher level functions like decision making, and they are among the last areas of the brain to mature. They might not be fully developed until halfway through the 3rd decade of life. The development and maturation of the prefrontal cortex occurs primarily during adolescence and is fully accomplished at the age of 25. In the United States, we do not allow children to drive until they are 16 years old. They have to be 18 to go into the armed services. They have to be 18 years of age to be charged as an adult. They have to be 18 to vote. They have to be 21 years to drink alcohol. A child at the age of 12 is not developmentally capable to make a decision regarding an emergency use vaccine that could potentially cause injury without the informed consent of the child's parent or legal guardian. Thank you.
Thank you, Representative Committee. Do we have questions? You are off the hook, Representative. Seeing no questions, we will move into the testimony phase.